Well, let's get started. Good morning, everyone. Welcome to the January 6th Public Health Briefing. You will hear from the Public Health Officer regarding our case rate and the new health order that went into place at 8 a.m. this morning. You will also hear from other public health staff regarding testing. We will then open it up to the public for questions, not the public, the media, apologies, for questions. And with that, I'll hand this over to Dr. Casirier.
Good morning, everyone. Thank you for joining us. So just to go over the numbers, and these are based on numbers from yesterday, 182,482 cases of COVID-19 reported to Sacramento County. We're averaging about 1,250 cases per day. In comparison, on December 23rd, which is about 2 weeks earlier, we were averaging about 400 cases per day. The case rate is at 83.7 per 100,000. In comparison to December 23rd, that was at 26.5 per 100,000. So you can see that we are experiencing a spike in cases, about a 3 to 4-fold increase. The hospitalizations from the last report, we are 291 cases of COVID in the hospital, including 55 in the intensive care unit. In comparison, on December 23rd, it was 160 in the hospital and 55 in the intensive care unit. From this, you'll notice that even though we have seen an increase in hospitalized cases, the ICU cases have remained about the same, and this is something that we are seeing across California in terms of increased hospitalizations, but not the same level of increase in intensive care unit beds. The recent surge is mainly due to an increase in the Omicron variant. The Omicron variant is now the predominant strain and accounts for 50 to 75% of the specimens that we are sending for whole genome sequencing. And definitely the holiday gatherings and travel also contributed to the increase in cases. Although we are seeing an increase in cases among people that are vaccinated, I think it's important for people to remember that it's still a much higher risk for the unvaccinated. So for unvaccinated, they have a 4 times higher risk of infection, an 18 times higher risk of death, a 10 times higher risk of hospitalizations, and a 17 times higher risk of ending in the intensive care unit. So we continue to ask that people who have not taken the opportunity to get vaccinated, please do so. And for those that are eligible for the booster, that they go ahead and get the booster dose. And lastly, with the numbers, with the deaths, we are 2,559 deaths. We're averaging about 3 to 5 new reported deaths per day. And you'll notice that the deaths also have not increased, but usually there is a delay or a lag in increase in deaths compared to cases. So we continue to monitor that. This morning, we issued a new health officer order suspending in-person public meetings and asking that those meetings be held virtually. We are also encouraging other entities that are not covered by this order to consider having their meetings internally, virtually, and also take other measures to protect employees. The state also has issued several new guidance and orders, so I'm going to turn it over to Nick to give a brief summary of those new orders.
Thank you, Dr. Casirier. Yes, so California Department of Public Health has made several updates recently of note. Quarantine and isolation guidance for the general population has been updated. It generally aligns with CDC's recent updates, although there are some slight differences. So isolation for people who have COVID-19 can end after day 5 if they are asymptomatic or have resolving symptoms and test negative on a specimen collected on day 5 or later. This second piece differs from CDC. For quarantine for people exposed to someone with COVID-19, that can end after day 5 with a negative test on a specimen collected day 5 or later. Of note, people who are vaccinated but not yet booster eligible, or people who are boosted do not need to quarantine if they are exposed, but they do need to test on day 5. The state has updated several health orders that include vaccine requirements for certain workforce sectors. Those have been updated to reflect a shift from fully vaccinated to up to date, which reflects having received a booster dose if eligible to receive one. So this applies to previous orders that were issued affecting workforce sectors, including the healthcare workforce, correctional facilities, and adult care facilities. The state also has announced an update to some changes with thresholds for mega events effective January 15th. The threshold for indoor mega events will be lowered to 500 attendees, and the threshold for outdoor mega events will be lowered to 5,000 attendees. And also, as many of you are aware, the state has extended the temporary indoor mask mandate. The statewide mandate was initially announced to be in effect from December 15th through January 15th. They have extended that through February 15th. Sacramento County already has a local order in place, so there is no local impact with that. And that's it for me.
Liz, do you want to go ahead?
Yeah, thank you. Hi there, my name is Liz Gomez. So Sacramento County has 13 county managed community testing sites. We are seeing significant demand and are seeing wait times ranging from 1 to 3 hours. We are increasing staffing. However, our staff and their families are also impacted by the increased transmission we're seeing, and therefore it is a challenging situation. In 3 days this week, we did as many tests as we did in 5 days last week. Last week, we did 50% more tests than 2 weeks prior. We expect to do over 15,000 tests this week. At this time, we have both PCR and antigen tests available at our community sites. However, the supply situation is challenging. We're working hard to ensure that we don't have any supply constraints. We know that outside of our 13 free community testing sites, there are other testing access points available, whether that's through your insurance, other community access points and pharmacies. We recommend that community review all potential options available, many of which are on our website. Thank you.
With that, we will open it up to the media for questions. As usual, please raise your hand. I will call on you one question at a time. If you have additional questions, please re-raise your hand. Anyone have any questions? Karma, go ahead.
Good morning. A couple of questions. In terms of the recommendation that private businesses also go remotely or virtual for those meetings, Dr. Kasiri, should private businesses return to remote work altogether?
That does depend on their business needs. So in our order, we did recommend that businesses look at other measures that they can take to protect their employees. And so we are aware that some businesses have gone ahead and allowed for telework.
Okay, and additionally, with regards to testing and testing capacity, recognizing that there are a variety of community sites that are operated by different entities and seem to have different systems, and whether it's registration or who administers them, some are offering take-home tests. Is there a clear list of where people are able to find take-home COVID-19 tests from a county provider?
Liz, do you want to respond to that?
Sure. So at this time, our county COVID-19 testing sites do not offer take-home tests. Some of the sites were provided take-home tests from the state. However, as I think you've seen, they were in hot demand, so they are out. Our libraries also had those tests, and I know that there was information that was provided out about that, but at this time, we haven't received any additional shipments from the state, and therefore, there's no additional information we have on take-home tests.
Gotcha. So just to be clear, in terms of getting take-home tests from a county provided entity, there's no expectation that there's going to be more of that happening.
So I wouldn't say that. It's just at this time, we don't have any additional supplies from the state. We hope that we'll receive additional supplies. And if that does happen, we'll make sure that everybody is aware of those access points.
Thank you.
Mike with the SACB, go ahead.
Yeah, hi. I was wondering if Dr. Cyrier could go into a little bit more detail on the reasoning for this morning's health order. I understand in the statement that went out this morning, it mentioned the need to keep essential government services operating. But I was wondering if you could go into a little bit more detail on that. And also, does the health order apply to the California legislature in Sacramento?
As far as the reasoning behind it, this is a measured step that we can take that would allow us to be able to continue providing access to public services without cutting off that access for the public. So being able to have these meetings virtually does that. And what we have also asked is that other entities not covered by this order do the same. I am not in a position to be able to address the state legislature. That would be something for their lawyers to be able to address.
Mike Duffy, go ahead.
Sure. It sounds like a lot of this advice is for large gatherings. Should this naturally apply to schools, and will it eventually?
Right now, we are really prioritizing being able to keep the schools open. And so we have additional measures in schools to be able to do that, such as requiring masking, such as being able to provide testing. And in fact, at the state level, they are prioritizing all testing supplies that we have to make sure that we have enough for the schools. And we also work very closely with the schools to be able to do contact tracing and try to minimize exposure in that environment.
Chris Hooks, go ahead.
Hi, thank you for having this. I know the state generally has projections 2 to 4 weeks out. Is that something that the county also has in terms of hospitalizations, projected case rates, things like that? And if so, what do those look like?
What we have received from the state is that we do anticipate for the next couple of weeks that we will continue to see an increase. And so that's why it's really important that all businesses look at their operations to see how they can continue to protect their employees. We also actually, because of the impact on hospitals, do request that people who do not need to be in the emergency room reserve the emergency room services for people that have emergencies. So we've heard that some people have gone to emergency rooms to be able to access testing, and we request that those individuals go to other sites within the community where they can access testing.
And quick follow-up, if I can, Samantha, is there a number on those projections that you will be able to share? I mean, just trying to think a little, I mean, knowing that where we were 3 weeks ago before the holidays and where we are now, obviously hitting numbers that we hadn't seen before in the pandemic. Is there a number that you can share what those look like for projections?
I don't have a number to share, but what we have been told is that we can expect that we will continue to see an increase. And that's why it's really important to make sure that people also take other measures. Every individual takes the measures that they can to protect themselves, such as getting vaccinated, getting a booster if you're eligible, and also wearing a mask when in public.
Brandy, go ahead.
Thank you. With the high demand for testing, I wanted to follow up on a message I sent to COVID Media on January 3rd to find out whether the county public health office has recommendations for the public when it comes to free pop-up testing sites, which are not listed on your website.
We know that there are a lot of different providers providing COVID testing. And so we provide some information on non-county sponsored sites that we're able to take a look at and place on our website, but we aren't able to audit all the potential sites that may pop up in the county. I'm not sure if that directly answered your question.
Just more, is there some recommendations from the county for members of the public to be looking for to verify whether a site is handling, the testing appropriately or licensed to do so if they're not on your website?
So the county's not able to, verify any possible site that comes up. However, when there has been a complaint that's come through, we've definitely shared that with the state testing task force to make sure that they're aware. However, this is why we provide our 13 sponsored community testing sites that we can ensure meet certain quality standards. And so we encourage community to, access sites that they trust.
Daniel, go ahead.
Hi, yeah, we have this Dine Downtown event in Sacramento that's starting tomorrow through the 17th. Does the current situation, has that changed any kind of public health plans for it? Do you anticipate any changes? Should people feel safe going to this?
I think people do need to do their own individual risk assessment for situations like that, especially for people that have chronic conditions that put them at increased risk. I think they need to consider whether they need to go in certain gathering settings or not.
Cool. And then just to follow up, would you still recommend that people dine indoors, go to the movies, do things about town kind of as they have been? Is that the things that you're still doing amid this surge? For Dr. Kasiri?
I think it's important for people to be aware of the situation that we have with the surge and to make those decisions on an individual basis based on their risk. I highly recommend that if you're going out in the public that you are vaccinated and boosted if you are eligible for a booster. And if you have any symptoms, please stay home. Please, if you're in the public, wear a mask.
Alex with SACB, go ahead.
Hi, thanks so much. I wanted to ask, at this point, do you have any plans on releasing additional public health orders that would, for example, require restaurants and businesses to check vaccination status? And if not, I'm wondering why, given the fact that we have a higher case rate now than ever before, and our vaccination rate countywide is still not as high as it should be, relative to other counties in California. Thanks.
We continue to monitor the situation and look at steps that we are able to take. At this point, we do not have any additional steps that we are planning to take. I think it's really important for individuals to, again, look at their risk and take every measure that they can to protect themselves. And that includes highly recommend that you get vaccinated. We are not requiring businesses to do the verification at this time, but definitely businesses can choose to do so. There are requirements for large or mega events for vaccine verification and for testing.
Chris Hagan, Cap Radio, go ahead.
Thank you. Thank you for sharing the hospitalization numbers earlier. I was wondering if you could talk about the hospital and ICU capacity in the county, and if you have any fears that we may be reaching those limits soon.
The hospitals are full, and that is why we are asking that individuals that do not need to access the emergency room leave those services for people that do have true emergencies. We are working very closely with the hospitals in terms of monitoring their surge capacity, and also working with the state to monitor the situation.
Chris Hooks, go ahead.
So I hear you talking about the hospitalizations and the hospitals being full again, and it just sort of reminds me of everything that we've already been through. It just feels like deja vu over and over and over again. So are some of the same requirements that the county and the state are doing, are those even enough to stop us from exceeding some of the record numbers that we saw in last winter's surge?
You mean in terms as for the hospitals?
In terms of hospitals, stopping increasing hospital numbers and stop increasing case numbers, everything essentially. I mean, is what we're doing even enough? Are the requirements that the state and the county are imposing even enough?
We're continuing to monitor as far as the hospitalizations, as I mentioned, working with the hospital executives and with the state to look at additional ways in which we can expand that capacity. And definitely it is something that we need to be watching very closely. We do have the capacity to increase the surge, but I think some of the challenges we have are also this time around is that staffing is also an issue. So continuing to work with the state to be able to make sure that the hospitals have adequate staffing as well.
Karma, go ahead.
Hi, Dr. Kasiri. I apologize. I had to step away for a second as you began to talk about schools. So I apologize if this is asking you to restate that. But with regards to schools, is the county going to be taking guidance from the state along those guidelines, or is there any chance that the county would take some steps ahead of the state with regards to whether or not schools should stay in person?
The priority is to keep schools open. We do, of course, monitor very closely school by school in terms of if there is a large outbreak, we will revisit that, but we do not anticipate having to close all the schools like we did last year.
Gotcha. But in terms of making that call, is that something that the county is going to look to the state for guidance on, or will the county independently evaluate whether or not that's necessary?
We work very closely with the state.
Mike with SACB, go ahead.
Yeah, I think it might have been Liz that mentioned earlier, they're not currently plans for at-home test distribution because we haven't received any additional shipments from the state. Does the state control these larger supplies of at-home shipments? Is that something that the county doesn't have its own, ability to get a stock of in large quantities?
Yeah, so the community testing sites are also in partnership with the state because we use their technology systems. So they have contracts with the registration platforms we use, and then they also provide the supplies. So the PCR, the antigen, and then as well as any take-home supplies. And so we're really thankful for that because you all might remember, in one of the first surges, we didn't have significant testing capacity. And so the state has really been great at opening the state lab and providing supplies and technology. And yes, that means that we are dependent on those shipments and those contracts that they have to, have the supply chain that we need to manage those for the community.
And a really quick related question on testing is, with this high demand, are we seeing a longer turnaround times for the PCR test results to come back?
So we have always communicated out that it can take up to 72 hours, and that is from the time that the test gets to the state lab. And so in previous weeks, we have seen the turnaround time significantly below that. But the state in their contract with the Valencia Branch Laboratory has a 72-hour turnaround, and we're still seeing it meet the 72-hour turnaround requirement.
Randy, go ahead.
Yes, I wanted to follow up on the data shared regarding hospitalizations and ICU cases and tracking that data for hospital capacity. I've been inquiring and haven't gotten a response yet in regards to the discrepancy between the county and the state dashboards with this data. It does appear that now hospitalization numbers are aligned, but the state dashboard shows 69 ICU cases and the county shows 55, which Dr. K mentioned today. Is there a reason for this discrepancy?
It is dependent on when the dashboards are updated and also the source of the data that we're getting. So, because of course, as you can understand, the data is changing constantly. So, it depends on when update occurs.
Chris Hagan, I can't tell if you have another question or your hand is just still up.
Yes, I had another question.
Okay.
Right now, you talked about that there aren't any plans currently for, say, additional restrictions on businesses or moving schools to virtual learning. Does the county have any thresholds when it might take some of those measures?
We do not have any specific thresholds. We continue to monitor and work very closely with the state on if there are any other measures that can be taken.
Daniel, do you have another question?
No, thanks.
And Brandy, do you?
I do. Following up on another question I had earlier this week, can you provide the number of tests that were distributed to each of the libraries earlier this week for the community?
You'll have to get that from the library PIO. We gave just over 91,000 to the public libraries, and then they determined how many each individual library received.
Thank you.
Alex with the B, go ahead.
Hi, yeah, as a follow-up, I just, the big question right now is where can I get a test? And I know there's many options, but a lot of options are either not available. People are showing up to pharmacies and there aren't tests, or people don't have time, right, to show up to 3 different places. I'm wondering if you could walk us through any sort of relief that residents could expect over the next few weeks. Do you expect a larger shipment? Are you, haranguing the state for more supplies at this point? I guess, what sort of confidence should the public have in the ability to get a test easily over the next few weeks, given the problems we've been having over the holidays?
Sure. So there's a couple different things that are leading to this. One is supplies, right? If there were unlimited supplies, then we could add additional access points. That could be those take-home kits, right? If there were 5 million take-home kits that we had, we could add additional access points. So supplies is one thing. The second piece is staffing. So as I mentioned earlier, we do have significant impacts on staffing. So our staff and their families are being impacted by COVID-19 as well. So when we add staffing, unfortunately, we also have folks that are calling out. And then demand, right? So we're seeing unprecedented demand just continue to rise and rise. So even when we're adding supplies and staffing, it's hard to keep up. And so what we're hoping is that we're working on all 3 of those areas. We're adding staffing, we are advocating for additional supplies and making sure that our needs are known by the state. And then we are working with our testing sites on increasing their effectiveness as they're there because of the increased demand. So, I can't say that something is going to change next week for community, but what I would say, I know you mentioned the time piece, and that's real. A lot of people don't have the time to wait in line. We do know that for the testing sites, you can get a test at our community testing sites if you wait in line. So when I have folks that call me, I say, I understand that the line is a challenge, and know that you can get a test kit at our community testing sites if you wait in line. So that's what we have for now.
Sam, you're on mute.
Sorry, Mike Duffy, go ahead.
Yeah, I just wanted to ask about, we're hearing a lot about this not being as serious as previous variants. And in fact, even with these increasing numbers, it seems a lot of people aren't taking it as seriously as they used to, whether that's from fatigue or whatever it is they're hearing in the news. Dr. Kasuria, is there anything you would say to really drive home the seriousness and what led to these decisions?
So what I've seen with the Omicron variant, one is that it's highly infectious, so it's spreading a lot quicker and impacting a lot more people as well as those that are vaccinated. But there are some differences that we are still continuing to monitor. One of those is the fact that we haven't seen as high an increase in intensive care unit beds. But again, that it's still early, so that might change. But from what we've seen from other countries, it does seem like people don't get as sick with the Omicron variant. But I say that and also point out that because there's so many more people that are getting infected, and we do have a lot of people that have underlying conditions that put them at risk, there is still a significant risk to people to get severe disease. So it's still very important for us all to take this seriously and take the measures that we can to protect not only ourselves, but our loved ones as well as our neighbors. So it's still very important. We know that the vaccines are still effective, especially for people that have gotten the booster dose, because even when they do get infected, they tend to get milder disease. And the risk is also still lower for them than it is for people that are not vaccinated. So very important to continue with those messages. You need to get vaccinated. Also, if you're out in public, wear a mask. If you have underlying conditions that put you at risk, you should avoid gatherings. And if you do have any symptoms, please stay home and stay away from others.
Can I just ask a follow-up to that? I know that in the press release, there were some numbers given about how this has compared to previous case rates or even the number of people being infected. Can you give me a sense so that the public can understand just very basically how this has compared to past peaks or past surges?
So compared to past peaks, what we have seen, or past surges, is that the numbers have gone up a lot faster than they have in past surges. We don't know when we will hit that peak. We're hoping it will be soon. And from what we have seen from other places, our hope is that this will pass through quickly and that we will be able to peak and start declining very quickly also. But there are no guarantees. As we've heard from the CDC several times before, is that with COVID, the virus is the one that, determines what's going to happen. And just as we've been surprised before with previous surges and previous variants, I think it's very important for us to continue to be very vigilant because we are not sure what is going to happen. We can only do what we have in our power to be able to control and reduce infections.
We are out of time. I will allow Brandy to ask her last question as her hand is already up, but then we will move on to the Spanish briefing. Brandy, go ahead.
Thank you, Sam. Appreciate it. So throughout the pandemic, the county has partnered with other agencies to make vaccinations accessible to individuals who have disabilities. Is the county currently partnering with any orgs or community testing sites and or making take-home tests more accessible to those in the disability?
I'll let Rachel answer the vaccination one.
Sure. Yeah, we are still working with partners to, reach homebound, and we also have partners that work with those that are have disabilities to make sure that they get boosters. So some of our pharmacy partners are still working on those projects, and I will let Liz answer if there's any. I don't know if there's a correlation with testing or not.
Yes, so whenever we set up the testing sites, we worked with the Disability Advisory Commission and we modified the physical layout of all of our sites to make sure that they were more accessible. We are actively work with them to make sure that if there are any additional testing resources available, such as the at-home test, that we can make sure that they are accessible to individuals with disabilities. And each of our individual testing sites, site lead has been trained by the DAC to make sure that if there's any individual who wants to access the site with disabilities, that they're able to successfully do so.
All right, that concludes the English portion of this briefing. We will move on and do this same briefing in Spanish. So please stay on the call if you are going to participate in that. I thank you all for being here. I will send out a recording of this briefing this afternoon. Okay. Susanna, and is anyone on from Univision? No? Okay. Well, Susanna, I'm going to let you start with Victor. As we did last time, can you ask your questions in English first so that Jana and I know what you're asking? And I'll let you take it away.
Okay, perfect. Thank you. Okay, so first question, kind of what we where you guys talked about at the beginning. Victor, if you can explain to us more or less the new ordinances or guides that the county is implementing as of today. So entonces la pregunta en español sería, ¿cuáles son algunas de las nuevas ordenanzas o guías que se están llevando a cabo aquí en el condado de Sacramento?
Básicamente lo que pide la Oficina de Salud del Condado de Sacramento es que oficinas gubernamentales que tienen reuniones abiertas al público las tengan disponibles a través de manera virtual. Esto es básicamente para aún así tener la oportunidad que el público tenga acceso a los servidores del público en el gobierno, pero mantener esa distancia y que protejan su salud.
So currently, this does not, let's say, affect anything with schools or businesses, maybe with capacities. It doesn't really affect any other, sector at the moment. So al momento eso no está afectando, digamos, escuelas o negocios o restaurantes que digamos, ¿así es?
Hasta el momento no. Lo que sí se pide a las escuelas, bueno, lo que se está haciendo en las escuelas y se pide a restaurantes o dueños de negocio es que mantengan esos pasos de seguridad, esas estrategias de seguridad para proteger al cliente y en este caso a los estudiantes en las escuelas. Utilizar las máscaras en las escuelas, hacer sus exámenes o las pruebas de COVID y obviamente tener las vacunas. Entonces, tener esos pasos de precaución para proteger la salud es lo principal que se pide en esos aspectos. Otro detalle en cuanto a las escuelas, se está haciendo un esfuerzo adicional para mantener las escuelas abiertas y tener los estudiantes dentro de las aulas, obviamente manteniendo esos esos espacios de salud.
Habló la doctora Kasiri, Dr. Kasiri talked about, that we're seeing about 1,000 cases, a little over 1,000 cases per day here in the county. What's kind of behind that? So obviamente la doctora del condado anunció que se está viendo un incremento significativo dentro del condado de casos de COVID-19. Ella atribuyó esto, se puede decir, a lo que es Omicron. Entonces, si nos puedes platicar, o sea, ¿cómo está la situación en el condado? ¿Cuántos casos por, digamos, 100,000 personas están viendo? ¿Cómo es la crisis ahorita en el condado?
Déjame, te pido un favorcito. Haz la pregunta en inglés para que la doctora la responda y yo tener, digamos, la frase completa viniendo de la doctora para que lo tengamos bien en los dos.
Bueno, sí, ella, porque se me hace que Dr. Kasiri ya lo había dicho al comienzo de esta rueda de prensa. Yo como lo quería en español, si ella ya lo dijo, obviamente yo lo voy a usar, no te preocupes por eso.
No, está bien. Yo nada más lo hago, no lo repito, sino lo repito lo que ella diga ahorita, pero para que lo tengas de una vez en este espacio.
Okay. So the question was for Dr. obviously Kasiri, what was kind of, behind the, spike in the county? And obviously there's various factors from what I'm understanding.
Are you asking me or Victor?
Is Dr. Kasiri still around? And she can answer, and then I can follow up right after that, just to make sure I have
I think she's off, but I can give you a couple of points on that one.
Okay.
So the local increase is consistent with what we see statewide and nationally. I think it can be attributed to the rapid emergence of a new variant that's highly infectious, coupled with holiday gatherings and holiday travel kind of all converging at the same time.
Y más o menos siguiendo lo que dijo Nick, sí, es algo que se esperaba, ver los números incrementar después de los días feriados, Navidad y Año Nuevo. Entonces, la esperanza es que en las próximas semanas se llegue a un punto que empecemos a ver esa gráfica bajar, que los casos sean menos y que las reuniones obviamente sean menos, causando menos contagio entre el público.
Otra pregunta, another question, and it has to do with testing. So, I mean, we know that testing has been going on for the last week, especially now with the holidays. And I know that there has been some issue with people obtaining a test or an appointment. And in one case, I believe one of the county officials had stated some wait times in some clinics could even be depending from 1 to 3 hours. Why is there this kind of, I guess, shortage in tests at the moment? Entonces, la pregunta en español sería, estamos viendo una escasez a lo que vemos de pruebas de COVID-19. ¿Qué está detrás de esto?
Can I jump in really quick? I just want to be clear. There's not a shortage of tests.
Yes.
Okay. Take it away, Victor.
Y precisamente como dice Samantha, no hay una escasez de pruebas, simplemente que la demanda por las pruebas ha incrementado por el número de personas que están llegando a los centros de vacunación y de pruebas dentro del condado. Entonces, las personas sí van a esperar más tiempo, sí van a recibir su prueba, si están dispuestos a esperar ese tiempo adicional dentro de los centros disponibles dentro del condado. Pero en sí no hay escasez de pruebas, simplemente la demanda es más grande.
Okay, thank you for the clarification. Gracias. And last question, when it comes to appointments, because we actually have been receiving inquiries on appointments, and even some of our personnel that have tried to do COVID testing, they have had an issue with getting an immediate appointment. Some people haven't been able to get an appointment maybe 2 or 3 days after, when they feel like, they're having symptoms. So what are some recommendations that people should do? Meanwhile, they go to their appointment. Should they still go to work? What can, they do in the meantime? So obviamente, en español sería, mucha gente están teniendo problemas al obtener, una cita para hacerse la prueba de COVID-19 hasta 2 a 3 días después de que sienten sus síntomas. Entonces, ¿qué tienen ellos que hacer al momento para, digamos, prevenir esos contagios? ¿Tienen que ir a trabajar todavía? ¿Cuáles son algunas recomendaciones?
Obviamente lo principal es mantenerse en contacto con su médico de cabecera. Los pasos que ya se han recomendado, obviamente estar en cuarentena, ahorita son por 5 días, y después tener su prueba. Eso les da un espacio para poder tener tiempo de, digamos, de ir a hacer la prueba. Obviamente, depende de qué tan crítica sea la situación, de que tengan que ir a trabajar o que tengan que tener una prueba lo más pronto posible. Lo más recomendable es de que vayan a los centros de vacunación y de pruebas y sí, esperar 3 horas para hacer su prueba de COVID y tratar de recibir sus resultados en lo que son 72 horas, en 3 días. Eso es lo más recomendable ahorita. Pero otra vez, sí va a haber una espera un poco más grande comparada con lo que vimos hace 1 mes, 2 meses.
Perfecto. Okay, I think we're good. Thank you.
Okay, since no one from Univision is on, we can conclude this and I will send everyone a recording of the briefing this afternoon.